Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in the last presentations, we were talking about the wrist and hand complex biomechanics. Now in which we will talk about the kinesiology of wrist complex, which includes osteokinematics and arthrokinematics of the wrist complex. So first is the osteokinematics, in which flexion and extension, which occur in the coronal axis and in the sagittal plane. The normal range of motion of flexion is about 0 to 85 degree, and degree of extension is about 0 to 80 degree. Flexion is not pure, it is either ulnar deviation to the oblique axis. So ulnar and radial deviation occur in the anterior posterior axis and in the coronal plane. And the range of ulnar deviation is about 0 to 30 degree normally, and radial deviation is about 0 to 20 degree. So this figure represents the wrist extension. It is a wrist flexion, it is a wrist radial deviation, and it is wrist ulnar deviation. Next is arthrokinematics. So first is wrist flexion and extension. So it is a synovial joint, so it mostly follow the concavo-convex roll, in which roll and slide will be in opposite direction, and dorsal roll during extension and ventral slide lunate moves on styloid process of the radius. Extension at radiocarpal joint. The convex surface of the lunate rolls dorsally on radius and slides ventrally. And flexion at the radiocarpal joint, the concave surface of lunate rolls ventrally and slide dorsally. Next is the extension at mid-carpal joint. The convex capitate moves on concave lunate, and there is a dorsal roll and ventral slide. And during flexion at mid-carpal joint, which is occurred by the ventral roll and dorsal slide. Ulnar deviation also follow concave convex roll, in which scaphoid, lunate, tricutrium rolls on the ulnar side while slightly slide away radially in the radiocarpal joint. And in radial deviation, the amount of radial deviation is limited into impingement against styloid process. Therefore, most of the radial deviation occurs at mid-carpal joint and hamate tricutrium separate at the end of the radial deviation. Thank you.